Good afternoon, everyone, and welcome to Beyond Telehealth and Telemedicine is Medicine. My name is Dr. Lisa Finkelstein, and I'm going to be your host today. And it's exciting. We have Karsten Russell-Wood, who is with Philips, which is a wonderful company that I was exposed to when I was a resident, mostly from the radiological side of things. But Philips is doing a lot of great things. So Karsten, introduce yourself and tell us about Philips.
Thanks, Lisa. And to start, as I met you and your mission at Beyond Telehealth, I couldn't have found a better partner to broadcast the opportunities in virtualization of care and the opportunities to bring telehealth into the clinical frame from hospital to home. So again, my name is Karsten Russell-Wood. I presently serve as the portfolio marketing leader for post-acute and home at Philips. And, we're talking about a journey. We've all been through a journey with COVID. Philips has been on a journey. It's a company that today is wholly dedicated to the health and wellness and outcomes of populations globally, with ambitions to save lives by 2025 in the magnitude of 3 billion. So really our goal, again, from hospital to home and from wellness to sickness, is really applying the right technologies with the right care transformation to ensure that it's possible and to make sure that it's possible not only efficiently, but also at scale. So I'm happy to be here today, Lisa. Thank you.
All right. Well, this is unbelievable. So I truly think that Philips could be one of those companies that can help transform healthcare into where we're going post-pandemic. I'm going to share my screen. Let's see if I can do this. And we just have a few slides. Okay, so this first slide is one of my favorite, and this is a quote by Eric Topol that says, "The hospital room of the future will be the bedroom." And this is what we're talking about, transforming healthcare. So Karsten, give us the vision of you and Philips as to how this is going to happen.
Well, I think actually, Lisa, the vision of how it's going to happen is much bigger than Philips, because it's really about delivering sustainable healthcare. The hospital room of the future will be the bedroom. First and foremost, we start saying, okay, well, how does that change our own psychological safety and thinking about what a home is and how a home is used? We know through COVID that our view of a home has changed. It's become the epicenter of life operations for us, from work to worship to working out and to education. And what's interesting is, while we are comfortable shopping online for groceries, for equipment, working, doing, teleworking, what we didn't do was truly telehealth. That came along through COVID, and COVID acted as a catalyst, which allowed different populations with different sensitivities to going into public, to going into a doctor's office, to leverage their home as a hospital setting, right? And that's absolutely transformational. Now, I think Dr. Topol also, as a futurist, is looking to see that the capabilities that help mitigate the trade-offs in medical equipment of precision and accuracy now enable physicians to monitor patients in a home setting that have higher acuities and require more continuous physiologic monitoring, more continuous updates of telehealth consults, and of course the linkage to the pharmacy and beyond. So I'm absolutely bullish on the concept, and as we look across how the health system and consumerism has adopted this construct, it has also been very positive.
Well, let's look at the next slide, which goes along talking about you being bullish. And I also really like this slide, which talks about virtual care as, being in our future, with the bedroom being the next hospital room. So, can you explain this in layman's terms to our audience what this is all about?
Sure. If we think about where a health system or a system of care is orienting its revenue, what we're seeing here as part of the 2020 development report from Deloitte is the significant areas of growth are in retail and home health, with virtual care being an enabler. So let's focus on retail here. We see that it's got a growth rate of nearly 20%. So imagine year on year, we're going to see that sector growing significantly. And why is that? And what is it, right? Retail health is our ability to leverage our broad pharmacy network that we're all familiar with in our consumer lives, but also the ability to bring retail into other aspects of our life, such as shopping, right? We've seen examples of the Walmarts and the Costcos of the world that are actually bringing the experience of healthcare, both health and care, into their pharmacies. So I can have a telehealth consult while shopping for groceries. On the other side, when we look at home health, not only if we look at the projected shift in nursing labor forces, but also when we combine that with our aging population and also the consumer mandate for receiving care at home, this is also an area that's growing quite fast. So the way to look at this and translate it is there is a mass migration of care from the hospital to the home and into the post-acute and ambulatory environments. And if we listen to some of the projections for care delivery and expect that anywhere between 25 and 50% of care will move from the hospital to the home over the next 10 years, then we have to identify the enabling technologies that's going to make that possible.
Yeah, I mean, I've been saying for a couple of years that the way that we're set up right now, as we were talking before, is we are very set up to bring patients to us. It is really physician hospital centric if you look at what's happening traditionally. And that's why there is pushback, because we're so used to having the patient come to us in our offices, drive to see us, get their care in the hospital, and to have this huge shift of sort of a consumer model where if it truly is all about the patient, then that shift is going to bring healthcare to them rather than how it's been over the last, since the beginning. Although that's not true. Physicians used to do house calls, which were a beautiful thing.
And I think, there still are physicians doing house calls. And actually, what I think telehealth enables is physicians doing more house calls.
Virtual house calls.
That's right. That's right. And, when we look at what we've experienced as consumers in our relationship with centralized, aspects of our lives, take for example, banking, right? Banking was a brick and mortar model until
Right.
now it's not. If we think about shopping, we used to always do everything physically and in person, looking for sales, navigating aisles. And now that either can be done online or it can be completely outsourced. And AI tools can leverage forecasting on inventory to make sure that we get what we want when we need it. And of course, we can even see that in our social lives, right? As we move to communicating more and more digitally versus in person. And part of that's because of COVID.
So that's the title here. We didn't start the fire. The fire has been started in all these other areas, and now it's getting into healthcare.
Yeah,
Yeah.
a little tribute to Billy Joel, right? And if we
Right.
think about the history there, but it's kind of a when people complain, we can say, yeah, we're all getting there, and we're doing it together. And I think so much of it, if we look at how COVID acted as a catalyst for this, we realized that when things were taken away from us, right? The privileges of access, the privileges of appointment-based engagements with physicians and nurses, we realized we had to do things differently. And it's truly a great example of ingenuity and innovation in a short term to say, how do we replace the emergency department visit? How do we bring physicians to an urban environment that potentially could be the epicenter of COVID, where they don't have enough staffing? And we need to support those individuals with remote intensivists or other specialists.
Hey, Karsten, I'm going to take a pause here, if you don't mind, and just tell our audience a little bit about what Beyond Telehealth is all about. So we are a company that helps small to medium-sized practices really optimize their telehealth program, whether it's existing or they want to start new. And it's about being more efficient so that practices can see more patients, which can lead to more revenue, but ultimately higher, increased patient satisfaction. Because really, all the surveys say that patients in the right conditions love virtual care. They really have shown that they're very satisfied with the care, oftentimes if it doesn't require a hands-on exam. So Beyond Telehealth will help practices get there. So I'm going to go to the next slide, which is again talking about what we have been talking about, which is looking at the home and these biotelemetry devices, this remote patient monitoring, all kinds of different names, where you've got all of these technology innovations in the home. So let's go to this next one. Virtual care from nice to have to a necessity. So can you explain this slide?
Absolutely. Many times when I reach the end of a webinar, one of the questions is, why hasn't telehealth been adopted previously, right? And really what we've seen largely is the incentives weren't there, right? We saw a significant amount of progressive organizations adopting different forms of virtual care, whether in the hospital or in the home, but their business case for doing so wasn't direct reimbursement through CMS or a funding agency. Even models such as hospital at home that had brief spurts of investment, when that investment dried up, they would transfer to a payer-based partnership. And the reason why is that the payer is ultimately the one that can benefit from making healthcare more efficient. So if we look at it, number one, we had a very limited window and funnel of funding that has turned into significant funding. We've seen that very specific use cases for telehealth, whether it was in the ICU, which is largely an area for telecritical care, or telestroke or examples like that, changed to a model where organizations viewed telehealth more as the first go-to, designing virtual first strategies and then putting in manual processes following. Of course, business models have changed where, as you mentioned, Lisa, health systems waited for patients to come to them in a reactive construct. But as elective surgeries dried up, as preventative screenings dried up, as patients were concerned and shared their concern for entering into an acute environment, business models changed insofar as health systems looked to create innovative ways to connect with their patients beyond the walls of the hospital. And lastly, of course, we've seen this evidenced as the growth rate during COVID of telehealth. And ultimately, many of the reports show that growth has been in the magnitude exponentially of over 4,000%. Now, some people will say, well, that's great, but it was need-based, so it's going to dry up. I think What we're going to see, of course, as thankfully we have a vaccine that's mitigating the spread, and more people are coming back to elective surgeries. There may be a dip in telehealth utilization. However, what we've started on this journey together is one that shows that telehealth is a solution that gains efficiency. And as we move to a model of value-based care, telehealth, if it's within the equation of efficient care and access, is one of the leading variables to benefit that.
Yeah, I couldn't agree more. All right, we're going to stop sharing and go back. So, yeah, we're definitely on the same page, but I'm going to play devil's advocate now with you and talk about the realities of what are happening that we're seeing since COVID with digital health. Is that it really became apparent very, very quickly that a lot of patients do not have the ability to connect with with technology, with innovation. And so it leaves a huge percentage of our population behind, again, which, the people that have and the people that don't have. And how do we overcome these major, major challenges of how do we get people hooked up to Starlink, and how do we, use that satellite technology and fast fiber and all of that to get it into every nook and cranny on this planet, right? Because we're talking about us, but the reality is that all of us in the world should be connected. So we have the challenges of reliable internet, and we have the challenges of people having these devices and the teams that are needed to make all of this innovation possible. When you sit down with your group and talk about that, what do you say?
Well, I think, we can be professionals in the companies we work at, but we're also consumers, and we see in our consumer lives examples of connectivity, right? And we see now as Mars comes online in videos, that we have to ask ourselves, how can we stream videos from Mars and not get data from across the street into our EMRs? But I think in general what we see, Lisa, is an inflection point in care delivery where the policy, which is supported by CMS, et cetera, is favorable towards this. We see health systems that are adopting it. We see payers that are supporting it. And we see providers and consumers now saying this leads to a better, quality of life and access. I think technology will help us as we continue to advance it to reach individuals, whether they're in I really hesitate to say rural or urban, because care deserts exist everywhere, right? I can find populations in Baltimore that can't receive care. So I believe that consumerism will help us also as it comes to health literacy. And as individuals become more literate, they'll also be more interested in engaging and participating in their healthcare. We also see the technology growth of 5G and other technologies allowing us to get to populations that previously weren't able to be addressed. And lastly, of course, with the flexibility and mainstreaming of healthcare technology, while it still is under the guise of the FDA and we have the 510K support for medical devices, technology that's as simple as a cell phone is now able to support patient to provider consults, which can really be the difference between a patient leaving their home, going to a clinic, driving to a hospital, and actually receiving the care they want in their bedroom.
The other challenge that I bring up often, it's not just the patients, but it's also the doctors and the providers that are very used to what they're used to. And like human nature, fall back on what they know and is comfortable to them, which, like we said, is to bring the patient to them. and put their hands on a patient. And believe me, Karsten, it took me several years for me as a traditionally trained urologist that likes to do physical exam, to wrap my brain around this change that is happening. And as a leader in telehealth, I have to say that it is extremely difficult and a challenge to get my peers to really embrace this change. And I say with all due respect, thank God for the pandemic, because without that, we were looking at another 10 years. And the reality is that the next pandemic is right around the corner. So, as we were talking about before, it would be a shame to let this crisis go by us and not learn how to embrace change to make healthcare more accessible to our patients.
I certainly think that COVID by itself humbled many of us, whether we're technologists or care providers, in understanding the magnitude of something such as COVID on how we care for individuals anywhere. And certainly that has been something that we've all gone through. Technology by itself, however, is disconcerting to adopt unless you understand the value that it brings. And I think, especially in the medical profession, we have to pay homage to the Hippocratic Oath, in the sense of saying, look, we do not want to do harm. And so, as peer-reviewed and published data becomes available, then minds can change. And really, it is now the work of those innovative organizations that have had remarkable outcomes in telehealth to publish. And it's their responsibility to get that to the world so that individuals can read about it and start believing in how telehealth inserted into a clinical workflow can create better outcomes. We are seeing that. There's been significant publication both in the ambulatory setting, in targeted populations such as high acute populations at home, and of course telecritical care, where we're seeing that telehealth embedded into the clinical workflow, not additive but integrated, can actually deliver better outcomes.
One of the projects that's happening right now is a large HRSA grant, a federal grant that we were, I would say, lucky enough, but now we have a lot of work to do with getting our program is Tele-ED, emergency department, to rural ED clinics. And the goal is to get data on how many miles have been averted transfers, whether it's in an ambulance or in a helicopter, in a fixed wing, and also out in the field with EMS. There are about 30 institutions that are involved in this particular grant. There's many others, but it is to try to capture what works and what doesn't work. And it's exciting for me, but it's challenging. It's challenging to prove that this new innovation is meaningful, is valuable, does work, and doesn't do harm. That's another thing that physicians worry about, is the liability also part of it.
Yeah, that's a great example where, for the immediate term, it's good to do the pilot, right? And you have to create the pilot. However, at the same time, individuals are going to look at the addition of telehealth beyond COVID and say, demonstrate the ROI, demonstrate the return on investment. And it has to be more dynamic than just the financial model. It also really has to be VOI, value of investment, right? And today, that value for a health system, as you mentioned, could be, we are caring for more community members in the community versus transferring them. Our physicians have a better work-life balance and are indicating that they have reduced burnout. We're actually being more efficient in using our acute resources versus extending care beyond the walls of our hospital into individuals' homes. So certainly, I think as we identify those variables that we need to test, it's also that we have to test it not just in the pilot, but at scale and over time. And those are usually where telehealth programs, if they're too heavily invested at the beginning, fail. So we
Right.
have to make sure that we monitor them and build them to be scalable and sustainable.
One of the other positives of COVID is that, so I live in Wyoming, and one of the things that happened fairly quickly around the country is that tertiary care and quaternary care institutions that were getting an influx of very sick patients, as opposed to us out in the rural area, we would meet once a week and do this sort of COVID call where there was this immense collaboration and coordination of care throughout this entire region, where everybody was exchanging information and seeing what we were doing and transferring patients and not transferring patients and lifting everybody up. It really was true. It just started dying down. But for the past year, it was truly amazing to listen to these phone calls and these doctors collaborate together to help their patients. I think that was just one of the best things that ever happened.
Yeah, and there are organizations that have recorded those as, they call them patient saves, they call them kind of innovation moments. But it's so important because those are the anecdotes that stick with individuals. So I think that's great to be able to share that. The other thing is it's really broken down some barriers where people are acting more from a cellular structure organizationally versus hierarchically, opening, breaking down boundaries for individuals to talk about innovation, talk about outcomes. And now, of course, with data, hopefully we can start benchmarking the progress of different EDs to your project, Lisa, and the outcomes that they've created. Hopefully, through publication, we can also see how models are different and which models are more successful and which models can better themselves or gain value from watching another experiment work.
I'm going to leave this with one last explanation because it was a new term that I knew about but never heard about. When you talk about consumerism and participatory health, which you did touch on, but can you explain that to the audience, what that is?
Yeah, absolutely. And I pay respect to Jane Sarasan Khan, who's a health economist in Philadelphia, who's been writing on the subject for some time. But really, if we think about the concept of health citizenship, it really starts with us being more empowered and being more self-directed in our care. And as we elect to participate in our care, because we have access to data, whether it's digitally on our phones or on our computers, through EMR portals or through physician PCP websites, we then can ask questions that previously I think we may not have asked. We can also track how we are engaging in our health and what our outcomes look like. This could be as simple as weight management, smoking cessation, through to greater chronic disease betterment, such as diabetes management, heart failure, cardiac rehab, et cetera. And what we're seeing now is the consumer, through their participation in their health, is electing to produce more data. So, hate to throw another new coined word on your listening audience, but we think of the dawn of the healthcare prosumer, who's really saying, look, I can help you care for me better at a cheaper rate, right, with more efficient premiums, if I also give you some of the data that I can produce, whether it's from my Fitbit, whether it's from my nutrition apps, et cetera. And I think that is going to feed into a system that allows for better care.
Well, there's definitely, I have my Apple Watch here that is already doing that, and I compete with my two brothers every day. But But yeah, it's been happening, and I know that Apple CEO Tim Cook, that's one of his goals is to focus on health and consumerism, and has some really neat ideas. Well, we'll leave it here. There's so much to talk about. This is fantastic. It's been great talking with you. Hold on one second. I'm going to end the broadcast, okay?
Absolutely.
All right. Thanks, Karsten.
Take care.